Thai political activist Sisuwan Chanya lodged a complaint with the Technology Crime Suppression Division Police this morning, seeking legal action against administrators of the Youth and Direct Democracy TH Facebook page for posting images of Thai protesters in a German town, allegedly containing messages deemed to insult and intimidate the Thai monarchy. He also asked the division to consider prosecuting 45 other individuals who he alleged has shared the content on social media. He also said that the Thai protesters in Germany, some of them living in exile to escape lèse majesté prosecutions in Thailand, held the rally on Saturday in Kern of Germany to coincide with the protests in Thailand organized by the Free Youth Movement and its allies who had originally planned to march to the Grand Palace. Blocked by a large police presence and a barricade of shipping containers and razor wires, the protesters were forced to change their plan and head to the residence of the Prime Minister Prayut Chan-o-cha inside the 1st Infantry Regiment camp on Vipawadi Rangsit Road. Again, the protesters were blocked, resulting in clashes between police and protesters, forcing the police to resort to tear gas and rubber bullets to disperse them. Mr. Sisuwan also submitted a petition to the National Human Rights Commission to rule on whether Saturday's protest at Dindang intersection was peaceful and without arms, as claimed by the Free Youth Movement and its supporters. He said that the protest erupted into violent clashes between the police and protesters, adding that he wants the Commission's ruling to be used as a basis to take action against the movement in accordance with the computer crime law. The Thai Maiton, or the Impatient Thais political group, lodged a petition with the Central Administrative Court today, asking it to hold an emergency hearing on COVID-19 vaccine procurement restrictions and to allow the private sector and local administration organizations to import alternative vaccines for use in Thailand. The group accused Prime Minister Prayut Chan-o-cha, Public Health Minister Anutin Chanvirakul, Public Health Permanent Secretary Dr. Kietiphum Wongrachit, and Dr. Withun Danwipoon, Director of the Government Pharmaceutical Organization, of failure in vaccine management, resulting in shortages and suffering. The group asked the court to issue an injunction to lift the state monopoly on the import of COVID-19 vaccines and to allow the private sector and local administration organizations to import them, citing the cases of Cambodia and Taiwan. Only 5 organizations in Thailand are legally authorized to import vaccines from abroad. They are the Government Pharmaceutical Organization, the Disease Control Department, the National Vaccine Institute, the Thai Red Cross Society, and the Julapon Royal Academy. The CCSA's assistant spokeswoman, Dr. Aphisamai Srirangsan, announced that people who test positive for COVID-19 using a rapid antigen test can now be immediately admitted for care under the home isolation program. She disclosed that about 40% of people who went for RT-PCR tests at hospitals in Bangkok have been found to be infected with COVID-19, and similar tests conducted at hospitals in the provinces show a 25% infection rate, whereas antigen tests in hospitals show about a 14% infection rate. Although people who tested positive with an antigen test kit can enter home isolation immediately, Dr. Aphisamai said that entering community isolation will have to wait until the infection is confirmed by an RT-PCR test. So far, about 100,000 infected people who are asymptomatic or have mild symptoms have already entered home isolation and are being supported by 246 primary healthcare units. There are 67 community isolation facilities in Bangkok with a total capacity of 8,800 patients. Dr. Aphisamai also said that field hospitals in Bangkok have been expanded to accommodate an additional 2,000 yellow category patients, and hospitals have been expanded to accommodate an additional 4,000 light yellow category patients. She said the Busarakam Field Hospital is currently accommodating 3,300 light yellow patients, 346 yellow patients, and 17 red patients. Meanwhile, Bangkok City Hall's Erawan Center has been providing transport services to take patients for treatment in hospitals. Currently, they are making 500 trips a day.